The less salt you eat, the better your health will be. This message has now been repeated so many times that people have started to believe it as a scientific fact. But you must understand one thing clearly. In medical science, nothing is ever absolute. Everything varies individually. The same major mistake is being made when it comes to salt. You can understand this with an example. The human body is like a city, an electrical city. In this city, sodium or salt acts like electrical wiring, and water is like electric current. Now, if there are no wires, what is the use of current? The flow of electricity cannot happen. Similarly, too much water without salt floods the system. And there is a very important aspect involved here: the hormonal response. When you consistently reduce your daily salt intake over a long period, the body interprets this as an emergency signal. As a result, a hormone system gets activated called the renin-angiotensin-aldosterone system, RAAS. This system normally activates when the body feels that blood volume is decreasing or electrolytes are dropping. Low sodium, potassium, magnesium, and a low-salt diet repeatedly activate this system. The result is that the body remains in a stress mode. Heart rate increases, blood vessels tighten, and if this continues for a long time, the heart becomes weak due to constant overwork. This may surprise you because most people are told that eating less salt keeps the heart healthy. That is true only when someone has high blood pressure specifically caused by salt. But not all high blood pressure problems are related to salt. Let's look at a medical example. There is a 45-year-old patient who works an office desk job. He has high stress levels but consumes a normal amount of salt. Despite this, his blood pressure is high. In this case, salt is not the problem. The real issue is stress hormones. If this patient is put on a low-salt diet, his blood pressure may decrease temporarily, but in the long term, the load on the heart increases. Another very important point is insulin resistance, meaning impaired insulin function. This means the body has to work harder to control blood sugar. Low salt intake affects insulin sensitivity in cells, and research shows that a low-sodium diet increases insulin resistance. This is why some people who follow a low-salt diet notice that their fasting glucose levels slowly start to rise, but no one pays attention to this. The focus remains only on salt. Next are digestive problems. Salt is involved in the production of stomach acid. Gastric acid is produced with the help of salt. When salt intake is low, stomach acid production also decreases. As a result, food is not digested properly. Protein breakdown becomes inefficient, and problems like gas, bloating, and acid reflux increase. What do many people do in this situation? They start taking acid-reducing medications, while the root cause is actually salt deficiency. Here's another example. A woman eats home-cooked food, avoids junk food and processed foods, and follows clean eating. Yet after every meal, she feels heaviness, bloating, and fatigue. When her medical history is reviewed, it turns out she has low sodium levels. As soon as she starts consuming salt again, her digestion improves, without any medication. Now let's talk about the nervous system. Sodium is a fundamental element for nerve signaling. Low sodium levels slow down nerve function. As a result, hands and feet may start to feel numb, there may be tingling sensations, and reaction time slows down. Sometimes people think this is due to a vitamin deficiency, while the real issue is electrolyte imbalance. Then there are mood disorders. Neurotransmitters in the brain, such as serotonin and dopamine, are indirectly affected by salt balance. In some people, a low-salt diet can cause anxiety, irritability, and low mood. Another aspect that is often ignored is older adults. Reducing salt too much increases the risk of falls in elderly people. Dizziness, low blood pressure, weakness, and poor body balance can occur. That is why, in geriatric medicine, extremely low-salt diets are no longer recommended without a clear medical reason. So the question is, what should be done? The answer is balance, not fear, because health exists in balance, not in extremes. Unfortunately, these things are rarely explained. There is no need to be afraid of salt. Just avoid processed foods, market snacks, oily and fried foods, and packaged items. Eat home-cooked meals, and most importantly, rely on your lab reports. Do not depend only on theory. Look at the numbers. I hope this video proves beneficial for you. Take care of yourself.